and we are years over and after stem cell transplantation. After with acute leukemia and will allow allogeneic blood stem cell transplantation and after fever and abdominal pain below. Upon 4% of lymphoma blood. For admission, catheter next day admitting into hospital with
My name is Taylor Binns. I'm 23 years old and I suffer from limbal stem cell deficiency. I grew up in Aurelia, Ontario with my mother and father there and as well with my 6 siblings. Jordan, Tori, Addie, Aiden, Yana, Christy. I think I got them. When I came to Queens, I was quite happy. My first year went very well. And then the summer came and then I decided I'd go to Haiti to help there. The clinic there that takes care of just thousands and thousands of people that need help. So the big thing there was they needed a new roof. We went to the beach for a day and then I come back that night and just had the most severe pain and redness in my eyes that I've ever had in my life. So in maybe a year's time, I went from almost 20/20 with my glasses to now being legally blind. The pain. The pain is the worst. I can deal with losing the vision, but you can't get rid of the pain. On the scale of you're being constantly stabbed in the eye and it just never stops. Taken away from me mostly was the freedom, the things that almost before were me. Playing all these sports, being on a team, being able to drive wherever I wanted. All these things were now taken away. With my schooling, I can't see a lecture screen, so I rely on other people, the notes. I look off my computer and just hope for the best that I've hit the right key and I can blow the fonts up to about a 30 and then see it. And I just try to act normal as much as I can and just accept that this has happened and I have to deal with it.
Well, right away I knew, like, if I was a match that I'd definitely do it. Just to know, like, if it's gonna help him, then, you know, I kind of do, like, whatever it would be to help him out. He's been through a lot, so it's kind of the least I could do.
She's giving me everything back that I've lost over the last couple of years. So, yeah.
He was really happy, and he's like, we'll go shopping, I'll buy you that coat that you wanted, or whatever. I'm just like, you don't really need to do that, like.
So within the next year or two, I should have most of my vision back. It'd be pretty sweet. It'd be nice. I want to hope for the better. I hope I can get back to doing the things I actually like. Love to be able to play rugby again, to be able to drive. Just things that people take for granted, I'm really looking forward to. I can drive now, which is amazing. I'm basically 20/20 with my glasses on. That's better than I had before surgery. I'm almost in disbelief. Since surgery, I've had no pain whatsoever. I haven't been able to say that for 4 years. I just have the freedom to do anything, all these things which I couldn't do before. I'm playing rugby right now for the Aurelia team. It's kind of validation that everything's normal for me as of now, and this is pretty much the thing that really defines that for me, being able to be at the pitch on Saturdays. I love being out here playing rugby. My dreams, as of right now, I'm currently studying for the MCATs, considering going into medical school to be an eye surgeon. I just obviously want to thank my sister for number one. Without her, who knows where I'd be. Her and everyone at UHN, Dr. Cole, everyone with Dr. Slomovic's team. Dr. Slomovic's the man. I can't thank any of them enough for what they're doing, and I can just hope that through things like this and through donors that more people can have this done for them and get their life back.
High-dose chemotherapy, followed by an autologous stem cell transplant using your own stem cells, is an important treatment option for younger and/or fitter myeloma patients. Although high-dose chemotherapy is very effective in destroying myeloma cells, it also destroys the normal healthy stem cells in your bone marrow. A stem cell transplant is therefore necessary to rescue and restore the bone marrow. The process involves a number of different stages and begins with induction treatment that lasts on average between 4 to 6 months. The next stage involves the collection of your stem cells. Stem cells are collected from blood, but to be able to collect enough for a transplant, you will be given treatment to mobilize the stem cells from your bone marrow into your blood. This consists of injections of the growth factor G-CSF and sometimes also an injection of cyclophosphamide. These drugs increase the number of stem cells in your bone marrow, causing them to spill over into the blood, where they can be collected easily. If you are having difficulty mobilizing stem cells, you may be given another drug called plerixafor. Stem cells are collected or harvested by a process called apheresis, in which blood is taken from one arm and passed through a cell sorting machine. This separates out the stem cells, and the remaining blood is returned into a vein in your other arm. The harvested stem cells are mixed with a preservative and then frozen in liquid nitrogen until the time of your transplant. The next stage involves treatment with high-dose chemotherapy. This is usually a high dose of melphalan given intravenously, with the aim of removing any residual myeloma cells you have following induction treatment. However, as mentioned before, the melphalan can also destroy normal healthy cells. Your previously collected stem cells are reinfused back into your blood, where they make their way back into the bone marrow. The transplanted stem cells then begin to make new blood cells. This vital process, which effectively rescues your bone marrow, is known as engraftment. The first sign of engraftment is a rise in your white blood count. This normally happens 2 to 3 weeks after the transplant. Until the new cells engraft, you are at high risk of infection because you have fewer white blood cells. It is important that steps are taken to protect you from infection and to treat you as soon as possible if you develop one.
Back and tell you about skin cancer. Yeah. So what is leukemia? The term leukemia means with blood cells. What leukemia is? Determined leukemia and diagnostic leukemia. Normally, leukemia is something when you have a irregular cells. No, it's not normally. So we have something to describe this. Yeah. So leukemia is when you're sick, and the different normally blood and leukemia. So bone is clinical lymphogenome and erythroid leukemia. Foundation, what is leukemia? And leukemia is now bad risk factor including, and this is leukemia with blood cells. There are 4 types of leukemia. Leukemia is common in children. It's impossible to cure one type of leukemia in children. What is one the never form of theory for leukemia? Leukemia is more common in men that, but this is a form of leukemia. We have to know that they have the CAP is genetic, and symptoms always in children, and the treatment always is in